Everyone. How are you this evening? Delighted that you're able to join us for this Instagram live. Um, so I'm just going to wait for Karen to come on now in just a minute and we can get started. I hope you're all enjoying the weather at the moment. Looks like we're finally getting a bit of summer, thankfully. Great to see you all joining. With Karen now, just a second.
Hi.
Hi, how are you?
I am good, thank you.
Thanks for joining us this evening.
No problem. Thanks for having me.
So I suppose, just to explain to everyone what we'll be doing this evening, the main purpose of this live is to dispel some of the common fertility myths that we hear our patients coming in with and that we've seen floating around the internet that can be causing undue stress for a lot of people who are currently trying to conceive and people who are planning on trying to conceive in the future.
Yeah.
So we have a few myths that we have heard that we want to tackle, and we also have received a lot of questions from yourselves. Thanks so much for sending those in. So I should just note to start with, we can't answer any case-specific questions. If you do have something that you're concerned about for yourself, you can, of course, contact us to book an appointment to get some tailored advice by logging onto our website at www.sims.ie. So I suppose we'll get started. The first one that we're going to talk about is the myth that the contraceptive pill can cause infertility, and we actually ran a poll on this. And we can see that 24% of people polled do believe that the pill can cause infertility. What do you think about that, Karen?
Yeah, so this is one that we hear all the time, and there's actually been loads of research into the pill and the effects that it can have on fertility. So the good news is that the overwhelming scientific evidence shows that the pill doesn't have any long-term effect on fertility. So obviously it does cause a temporary phase of infertility, which is what you want whenever you're on the pill. But once you stop taking it, normal cycles should resume for most people, so for a majority of people. If this doesn't happen, then it's a good idea to see your GP or to see a fertility doctor or some sort of specialist, as if you're not having regular periods, then it's unlikely that you're having regular cycles and ovulating. So that would also make it much more difficult to conceive. So it wouldn't be recommended to have any fertility testing while you're on the pill because of the suppression that it causes. And it's also important to bear in mind that often GPs or doctors will actually prescribe the pill for things like symptoms of endometriosis or to control periods for some people, so that they can have that regularity. But things like AMH testing wouldn't be recommended while you're actually taking the pill. But for long-term fertility, it isn't thought to actually cause any long-term problems.
Okay, that's good news, I think, for a lot of people out there. Thanks so much for that, Karen. Um, Another thing that we tend to hear is that age only affects female fertility. A lot of people don't seem to be conscious that it can also affect male fertility. And we've seen that 23% of people think age is only relevant to female fertility. Can you speak to us a little bit about that, Karen?
Yeah, so age is obviously very well documented for females. Unfortunately, as we age, it can be more difficult to conceive, and our risk of miscarriage or pregnancy complications increase as well. But for both men and women, delayed childbearing is often not done through choice. It can be for a number of reasons. So finances, careers, not meeting the right partner, or generally not feeling ready to start a family. So with that, with people kind of starting families later in life, there's more and more research being done into the effect that paternal age, so a male partner's age, can have on pregnancy. So it is possible for some men to remain fertile very late in life. However, this gradually decrease over time, and studies have shown that advancing paternal age can be associated with decreased kind of sexual function, as well as a reduction in sperm motility and morphology, so like the sperm health. So we have started to see more studies show that it can decline for men as well. Not to the same extent, unfortunately, as for women, but we also have to think this could also be for other reasons, such as lifestyle as men get older and other comorbidities, which may happen as men age as well.
Okay, that's very interesting and good to be conscious of for anyone making plans.
Yeah.
Um, Another thing that's cropped up for us as well is that a lot of people are under the impression, 29% to be precise, that the AMH test or the anti-Mullerian hormone test can give a definitive picture of female fertility. Is that the case, Karen?
No, unfortunately not. So AMH test alone does not give you a full fertility picture of someone's fertility health. It's a hormone which comes from the granulosa cells, which is in our ovarian follicles, and they contain the egg. Therefore, if our ovarian or our egg reserves are running low, then our AMH level will be lower than somebody that may have a higher number of remaining eggs. However, it doesn't tell us about the quality of those eggs, and it doesn't tell us if they're being properly released through ovulation each month. So this is why we say it doesn't kind of give a full picture of somebody's fertility. It gives us no information about the mechanism which is required for the egg to actually be released from the ovary, and to fertilize the egg and lead to pregnancy. It does give us information about the type of ovarian hyperstimulation, so the drugs that someone may need in fertility treatment. And it also gives us an indication as to how well they're likely to respond to some of these drugs. A high AMH can sometimes be seen in patients who have things like polycystic ovarian syndrome, or PCOS, as they can often be seen to have multiple follicles in their ovaries. But again, it doesn't tell us about the quality of the eggs within those follicles. What I will say is that patients who test their AMH early, who have AMH tests whenever they're quite young, probably before they even want to start a family, are much more likely to start trying earlier than what they had originally planned if they do find out, for example, they had a low result or a lower result than what they thought. So knowledge is power whenever it comes to things like that. And that's why we would recommend people getting their AMH checked early on so that we can find out, is there a problem, and if there is, you can act on it.
Okay, so it's a worthwhile test. It's just it won't give you a full idea. You may need to run
Exactly.
further tests.
It's
Okay.
beneficial to have other tests alongside it if you are having fertility investigations. Kind of don't be too down if you do notice that it is a bit low, because there are things that tell you about the quality.
Okay, that's great. Thanks, Karen. Another thing that we have heard quite a bit, and I think a lot of people tend to think this, is that fertility is a woman's issue. I know it's often kind of spoken about in female terms. Obviously, it takes two to create a baby. So, what would you say about that, Karen?
Yeah, so the focus is often put on females during fertility, the whole fertility process, and we know that it's about 30% relating to females, it's about 30% relating to male, and then the remaining 40% is generally either a combined or unknown. And that's obviously when we're talking about heterosexual couples. So whenever I say unknown, that doesn't necessarily mean that there's no problem at all. It sometimes just means we aren't quite sure exactly what that problem is. Or it's difficult to tell without looking at the relationship between the sperm and the egg whenever they're combined in the lab during fertility. So a lot of couples feel a huge sense of grief or injustice whenever they are struggling to conceive, which can leave them worried about kind of the impact that this can have on their life and their relationships. So we do need to become more aware that the struggles are both relating to men and women, and it does still need to be talked about more. We see as well that male partners try to be more of the support or the kind of the rock in the couple throughout the whole process, and this can lead to a lot of kind of pent up emotions, especially at the moment with COVID, and men for here in the clinic, men aren't able to attend all of the appointments, which can be really difficult, and they can sometimes feel a bit isolated from the process. So it's just really important to use each other as a support resources. Nobody knows kind of what you're going through as well as each other. You know, you're going through it together. So there's definitely more that needs to be done for the impact that male fertility has, and also kind of the mental health and stigma around male fertility.
Yeah, definitely. I think this year, especially, we've all kind of learnt how important it is to protect our mental health. So we need to kind of be conscious of the impact that fertility can have on men and their mental health and just open up the conversation a little bit more around that. I know sometimes it can be more difficult for men to talk about it, but it is important for us to be conscious of how it can affect men too.
Absolutely.
Um, so just moving on, I know this crops up, I think, for every medical concern, and I'm definitely guilty of it myself, but Google being the answer to your fertility concerns, what do you think about, do you think it's useful for people to use Google to kind of research, or do you think it's harmful?
Like Googling symptoms is completely normal. We all do it for different reasons. However, there are a lot of unreliable sources of information out there, which can cause a lot of worry and a lot of anxiety during an already difficult time. So it's obviously very individual to a person, but the internet can be a complete mine when it comes to fertility. There are lots of companies trying to sell products, or lots of biased information for different reasons. So it's just really important. I do think it is important to be proactive and do your research. However, try to use reputable, evidence-based websites where you can, somewhere that you know is trustworthy, or else speak to your GP or a clinic or a healthcare professional about the issues that you're specifically facing. So social media, for example, can be a really, really brilliant support resource, and it provides a great community for people who are going through similar situations. But it's just important to remember that treatment is individualized for people, and people's problems are all different. So many aspects involved with that does have an individualized approach. So it's just to bear that in mind. If you see somebody's having something and you're not having that, obviously ask your doctor about it, but it doesn't necessarily mean it's kind of one size fits all. But this campaign, for example, is trying to straighten out some of the myths that we hear over and over again in practice, but there's still so many more that we're not even going to be able to tackle during this session.
Yeah, definitely. I know we've got such a volume of questions in. It just goes to show how much misinformation there is out there and how much confusion there is. So it is great to have this opportunity to kind of educate the public a little bit, at least, about fertility.
Yeah.
Um, so another one that actually I think a lot of people would be confused by is that there's a myth that if you're trying to conceive, you should have sex every day. And we know 10% of people actually do believe that, but that's not always the case, is it, Karen?
No, and it's really common to think that. I mean, I can see why people think that, but the evidence shows that couples trying to conceive should have intercourse every 2 to 3 days, especially around about the time of ovulation or mid-cycle at least. That's assuming somebody's cycle is regular. So whenever I say regular, a regular cycle is considered 28 days. About 15% of women actually have a 28-day cycle. So we would say kind of within a week either side of that would be kind of considered regular. And sperm will only reach the egg around about the time of ovulation, as this is when the cervical mucus allows this to happen and creates the best, kind of most friendly environment for this to occur. So trying to time intercourse right down to the exact time of ovulation can be really stressful. And it can sometimes make couples feel like it's a bit of a chore more than anything. So studies have shown that couples who have regular intercourse throughout the cycle do just as well as couples who are trying to kind of time it to one specific period or one specific window of time. Another important thing to remember is that sperm can actually survive for up to 5 days in the female reproductive tract, especially during the fertile window. So by having intercourse every 2 to 3 days, you should capture that period of time where the egg is released through ovulation.
Okay, that's really interesting because I mean it would make sense to a lot of people that it would be every day, but it's great to know that it isn't
Yeah.
the case. So
No. So you should capture that period by having intercourse every 2 to 3 days.
okay, great. Thanks, Karen. And then this is a big one actually, and one that concerns a lot of people, I think. 83% of people believe that stress impedes fertility. Is that the case?
It's a really, really tricky one because it kind of goes hand in hand with treatment or with fertility struggles, but there's no hard, fast kind of scientific evidence that proves that stress does cause infertility. Again, it's another thing there's always a lot of research being done into, but it is a very common myth, and I think that it mainly comes from stories or kind of anecdotal stories of couples who claim they stopped trying and then they became pregnant really quickly, or they stopped having treatment and then they became pregnant naturally, which we've all seen happen and we've all heard of. But there's also loads of other factors at play there. So it's just important to remember that. I have no doubt that stress does play a role in infertility, but it's very difficult to quantify and it's very difficult to prove, and it's quite a difficult thing to study as well. Infertility causes stress. We know that they go hand in hand with each other, but I think the jury's still out on the relevance that stress actually has on fertility. Like, so although it's been proven to definitely have, so it's not been proven to definitely have an effect on fertility, stress can also often lead to kind of activities such as smoking, binge drinking, unhealthy lifestyles, or loss of libido, things like that. So there is a link there from that point of view. And I think stress is sometimes blamed whenever there's no other reason that can be found. But I think the most important thing is to just take the pressure off yourself where you can. It's actually very unlikely that anything you're kind of specifically doing is causing you not to get pregnant, assuming that you're living a relatively healthy lifestyle. And I mean that in a reassuring way, to know that you can only control what you can control and take every day at a time.
Okay, so basically, don't stress about being stressed.
Easier said than done.
Yeah, yeah, if you can.
Yeah, yeah. But yeah,
Okay,
pressure off yourself a little bit, because you can only do your best. You can only take every day as comes and take it from there.
definitely. Good advice. And then the last one that we're going to tackle in this section is that lying flat after sex helps with conception.
Mhm. Yeah, again, that's another common one, and I fully understand that as well. I think people often say that laying flat after intercourse would improve their chances through kind of the effect of gravity, or that probably comes into play a little bit. A study was actually carried out on patients who had IUI procedures. They were asked to lay flat for 15 minutes after the procedure, and then compared against patients who were able to just get up and move around after the procedure, and they didn't see any difference in the success rates from that. Like, I see no harm in doing it if it makes you feel better and if it makes you relaxed. You know, there's much more harmful myths out there, but I don't think it's going to be the difference in somebody conceiving and not conceiving if they're having regular intercourse over kind of a period of time. It's not have an effect on pregnancy rates, but not going to do you any harm.
Okay, okay, so good to know.
Yeah.
Okay, so we're going to move on now to some of the questions we got from you guys, and we actually got loads of questions, which is great. Thanks so much for sending them all in. So we did see some of the kind of questions overlapping, so they kind of fall into four main themes. So we're just going to tackle those four themes for now, and we hope that should cover everyone's questions. And those themes are IUI, male lifestyle and female lifestyle, as well as egg quality. So do you want to chat to us a little bit about IUI, what it involves, who it's suitable for, that sort of thing, Karen?
Yeah. So IUI is intrauterine insemination. So the goal of IUI is to increase the number of sperm that are reaching the woman's egg, or trying to increase the chance of fertilization. So normally during intercourse, a lot of sperm won't get past the cervical canal. So IUI allows the sperm to be directly inserted into the womb. So therefore trying to increase the amount of sperm that actually reaches the egg, because it's skipping a step essentially. So while the sperm starts to reach and fertilize the egg by itself, it's kind of a less invasive and less expensive option compared to IVF. And sometimes couples will try this off before they move on to other kind of more invasive and more expensive fertility treatments. The timing of IUI, so we would always, generally we would give patients medication until they develop a follicle, and then they're given a trigger to help them release that follicle. So the IUI is timed to whenever that ovulation is going to happen, and then the sperm sample is prepared by the lab in a kind of a more concentrated sample for the procedure itself. So couples sometimes would maybe do 3 cycles of IUI before IVF, as it's less invasive, and over 3 months you've probably got a similar success rate as one IVF cycle. It's less invasive, but
Okay.
don't go for that and go straight for IVF because they've been able to have regular for a particular period of time. It's very commonly used among same-sex couples or anybody needing to use donor sperm, or single coming through for treatment. Probably We would see that a lot because it's a, as I've already said, the kind of least invasive and expensive way to get the sperm to fertilize the egg. So the main
Yeah.
demographic we would see is the same sex or single patients, but we also see other couples as well.
Okay, makes sense. And it's actually funny, when we did put it up on our stories about all the IUI questions coming in, we had a former patient message us to say she'd just given birth after several years of trying to conceive from IUI. So it's some nice anecdotal evidence that it does actually work. Always
Oh,
good to hear.
so kind of it's about between 10 to 15% generally. Now that can be, success rates that is, that can be higher or lower for some people. So it very much depends on you as an individual.
Okay, great. Thanks, Karen. And then we did actually have a lot of questions coming in about things that you should or shouldn't do for a man when trying to conceive. Are there things that you would recommend avoiding for men or that they should be doing to just kind of optimize their fertility?
Yeah, so for men specifically, smoking is known to reduce the sperm health and increase the amount of DNA damage that's seen in the sample. So that's a really, really kind of detrimental factor that can cause harm to the sperm. So it's important to cut smoking whenever you're trying to conceive. Trying not to binge drink. Drinking in moderation is unlikely to kind of cause too much harm or too much damage, but binge drinking is more damaging. There's also some evidence that states that men who wear tighter kind of fitted underwear may have poorer sperm quality than those who wear loose underwear. That's likely due to temperature, as heat can kind of be seen as damaging to the testes. This includes, say, having a laptop on your knee or lap a lot rather than using a table, or kind of men who cycle a lot for long periods of time, or sit in hot baths, things like that. Um,
Mm,
Men who have a kind of a healthier diet, obviously kind of a more kind of Mediterranean type diet, are seen to have better sperm quality than somebody who maybe would eat a lot of processed foods, or uh,
okay.
so obviously just general kind of lifestyle or general kind of diet advice. And it's also really important to remember that sperm takes it takes 3 months to produce sperm. So these changes should be long-term changes, not short-term changes,
Okay.
over a few weeks. So it will take 3 months for kind of a new cycle to occur. So just to bear in mind, if you are kind of making any changes, you may not see any difference straight away.
Okay, that's definitely good to know because I know a lot of people probably would expect it that it would make a change immediately. So definitely good for people to know that it takes a little bit of time. And how about female lifestyle? What should or should you not be doing when trying to conceive?
Very, very similar to male lifestyle with kind of a healthy diet, being as active as you can be within reason. So we don't expect people to be able to be. I think psychologically, whenever somebody, for example, is having fertility treatment, there's no kind of hard and fast rules about what you should or shouldn't do within reason. But we would always say to people, if you're going to worry about something, then it's probably better just to avoid it if it's not going to cause you any harm by avoiding it. But apart from general healthy lifestyle, healthy diet, looking after your mental health as well, really important for both men and women.
Definitely.
Yeah, and taking your pre-pregnancy supplements, so folic acid, vitamin D, vitamin B, CoQ10 is really good supplements as well.
Okay. Okay, that's good to know. Thanks, Karen. And what about egg quality?
Mhm.
I mean, there are people, if you have low egg quality, is it a case of that is there anything you can do to help with it?
Yeah, so egg quality issues are probably one of the most common of kind of female fertility problems that we see, and it kind of goes hand in hand with aging, unfortunately.
Mm-hmm.
We can't fix the problem completely, even with fertility treatment, because you're unable to change the DNA in the eggs. However, there are things that you can do, like I've already talked about the lifestyle changes, but there are things that you can do to kind of improve your overall health and your overall kind of egg health, such as maintaining the healthy lifestyle, avoiding the binge drinking, avoiding smoking. There's also more research being done into the effect that toxins may have on fertility, so chemicals such as kind of plastic and things like that. So there's more research to be done, but it's an interesting one, and something to probably consider. Unfortunately,
Okay.
specific test for egg quality. However, we do find that people usually get quite a lot of information whenever they're going through treatment and they're having IVF, and we can see that relationship with the eggs and the sperm in the lab after an egg, whenever they're trying to grow an embryo and develop an embryo before transfer. So you can get some information from that, but again, it's a really difficult thing to kind of test for.
Okay, okay, good to know. It's really interesting actually that there's so much research being done on the effects of
Yeah,
toxins. So definitely want to be mindful of, even if we're not 100% sure yet.
yeah, definitely. I mean, again, it's a lot of people are more kind of conscious of that at the moment anyway, and trying to reduce plastics. But
Yeah.
it's something that's kind of still a big area of research, so we'll see.
Okay. Yeah. Watch the space.
Mm.
Thanks for that, Karen. And I suppose there's just one or two questions that didn't fit into those categories that we're just going to cover now. Um, One question we did get is, does having IVF bring on the menopause earlier?
Okay, so having IVF can temporarily bring on a state of menopause if somebody's having down regulation drugs, which not everybody have, some people do. And this is done in order to kind of control the cycle. However, this isn't permanent and it's just for the purpose of treatment. You can sometimes suffer with symptoms which are similar to the menopausal symptoms, such as hot flushes and headaches, and kind of generally hormonal symptoms.
Hmm.
You are stimulating the follicles from the cohort which are present in the ovary that cycle anyway, and they would kind of otherwise go to waste or go unused. So it doesn't kind of use all of the eggs that you have. The eggs that you're stimulating during an IVF cycle would have otherwise kind of left the ovary that cycle anyway, because one of them would have become mature and the rest of them would have just kind of been absorbed back again. So it doesn't kind of bring on menopause any earlier, but we do get asked that one quite a lot as well.
Yeah, yeah, definitely. I can see why people would have concerns there, but it's not really anything to worry about. No. Okay. And does bed rest help the embryo stick?
No, so it's we've already talked about it a bit earlier whenever I mentioned the study that was done with
Mm.
IU. This is a really common question that we get, and we often find that people, when they have an embryo transfer, are often afraid kind of nearly to stand up afterwards. But no, bed rest won't help the embryo stick. After embryo transfer, it's important to do. I've already talked about this in lifestyle, but it's important to do what you're comfortable doing. You know, don't overexert yourself physically or push yourself. However, bed rest isn't indicated and it won't help the embryo implant. A lot of the time as well, whenever somebody is having an embryo transfer, they would have had an egg collection a few days prior or 5 days prior.
Mm.
So it's to remember the side effects that come with that and the risk of complications from the surgery that you've had or from the daycare surgery that you've had. The uterus is also an organ, which is really important to remember. So good blood flow is important to kind of circulation should be promoted through moving around, and that you won't get that same circulation unless you are kind of moving around, and bed rest won't help, unfortunately.
Okay, okay. Good to know. We don't need to tie ourselves to the bed.
No.
No. Okay, great. I think that's all that we've got time for at the moment. I know I do see a few questions coming in here that are kind of case specific. Unfortunately, we're not able to answer those on this live, but if there is anything that you're concerned about, definitely do pop onto our website and book an appointment with one of our fertility consultants, and they'll be able to give you advice specific to your situation and advise you with next steps.
Yeah, and again, if there's any kind of general questions, you can DM the page and we can see if there's anything that isn't too specific that we can help you with. That's no problem.
Yeah, definitely. We're always here.
Mhm.
Okay, thanks so much for that, Karen. I really appreciate you coming on to talk. And thanks so much to everyone for tuning in. And this will be available on our Instagram page in the next few days. So if you did miss some of it, you can catch the rest of it when we post this. Okay, thanks everyone. Have a
Thank
good
you.
evening.